occupational therapy is often a misnomer, and I want to tell you what occupational therapy is. First of all, occupational, and I'll talk just about pediatrics. Occupational therapists work with people throughout their lifespan. In pediatrics, we work in many different settings. Some of you may be familiar with early intervention. We work in schools, hospitals, orthopedic settings, acute and long-term rehab, and a huge variety, and also in wellness. Now, there's a lot of OTs working and consulting in wellness. The goal of occupational therapy, its mission, is to make a match between the child and their environment. So adults need to perform different tasks in their everyday life than children. So what do children need to do? Throw it out there. What do children need to do? What aren't they doing for you that you would like them to be doing better?
Learn how to get dressed, how to eat.
Getting dressed. That's one mission of childhood. They need to learn how to get dressed. They learn to eat. They need to learn how to play. What else do they need to do?
Brush their teeth.
They need to brush their teeth. Yes, they do. And what else do they need to know how to do?
You still have like forks, spoons.
Fork, spoon, and you need to know how to manipulate utensils of all sorts. So eating utensils is one thing. They have to manipulate pencils and pens, or something else they have to manipulate, and so are keyboards later on. What else?
Interact with other kids.
Yes, they do. And the social piece is really very, very important, because I'd say the number one thing that the parents say that what they want their child to accomplish in the end is to be able to play with other kids and to have friends. I'd say having friends is the number one overall concern of parents, and everything else is commentary. So that's very important. And they also need to be able to play in different settings. They need to be able to play a board game, but they also need to be able to execute their gross motor skills and learn to sit and crawl and run and walk and play in the jungle gym as well, both alone and with other children. So here we see children with hardcore neurological diagnoses like cerebral palsy, Down syndrome, autism spectrum disorder, ADHD. But then we see many children who have no diagnosis at all. They're just kids who are having a hard time making it in the real life environment. They may not be able to sit at circle time so well. They may have a hard time sitting at a table with other kids and having a conversation when they're eating. They may give their parents a horrible time getting out in the morning. They resist getting dressed, they resist eating, they resist brushing their teeth. And if they know how to do these things physically, and they get a set of directions, they're in la la land someplace and they never get out the door. There are kids who are having a hard time learning in school. Some of these children are very gifted intellectually. However, very hard for them to follow a direction once they're given it, because they can't make their bodies do what their mind calls. So we see many children, and some children who have these difficulties that for which there seems to be no obvious reason. Some of them have sensory processing disorder, and that's what we're going to